$1,415 per month. That is how much it would cost me to keep my current health insurance plan. Now, based on this headline, I am an above average Texan because my premiums increased by 44.67% per month. Now, I have a job where my employer will reimburse me for up to a certain dollar amount. Even with that reimbursement, out of pocket, I would still end up having to pay $880 per month just to be able to have health care. That does not include copays, buying prescriptions, getting tests done, and that also doesn't factor in the fact that my deductible went from $1,500 per year to $2,000 per year. So these cost increases are happening to individuals, not just in Texas, but throughout the United States. These cost increases are happening across the board. This is going to be catastrophic for a lot of people in America, and I am not being dramatic when I make that statement. This article in the Texas Tribune says, estimates vary among health policy organizations, but hundreds of thousands, if not well over 1 million Texans, are expected to drop their health insurance coverage due to the Affordable Care Act premium price increases. And I will become one of those statistics. We already have people here in America who for years have been having to choose between buying groceries and getting prescriptions. We have Americans who have had to decide between making sure their rent or mortgage gets paid on time and putting their doctor's appointments off on the back burner. That is only going to get worse. And I have received emails saying, apply for financial assistance, and the amount of money that you need to be able to make to qualify for that. Those of us with jobs, we are just going to be left out in the cold because there won't be any options, for us who are well above the poverty line, but not yet into that tax bracket to where this doesn't impact us in some shape, form, or fashion. My YouTube friend Steve has always pushed me in the most positive way, right? Like he has always encouraged me to go full time with my online business. And I always respond to Steve and tell Steve, that would be great, but I need a job to be able to afford health care in America. And that is no longer the case. But it's a catch-22 because now if someone wanted to pursue any type of independent solo business on their own and have health care, you would have to just factor in the amount of money that it would take just to cover your monthly premiums. And you would need that as a starting point to kind of determine what you would need to make in order for you to break even. I have had 2 sinus surgeries within the past 3 years. And when I went to see my ear, nose, and throat specialist in November of 2025, I told him at that time, hey, whatever is wrong with me, we've got until December 31st to get it worked out because I will not have health care beyond that date. And he told me, he said, I have another patient in that same situation, and I know that there will be more. And so I told him at that appointment, I said, when I check out, I'm going to check to see if you have a self-pay option because that's the only way that I'm going to be able to see you. And he said, yes, I do offer, self-pay for patients who no longer have insurance or who don't have insurance. And so that's what's going to be my options, at this point. When I go to see my specialist, primary care physician visits for me are few and far between, but I do have a couple of issues that require specialists. And so that will become another line item that I will have to financially prepare for. And I know based on this article and just based on real life in America, that I am not the only person in this situation. So I'm going to keep an eye on these headlines, and I will be coming back and sharing any information that I find. And if you have any resources, please do drop them down below in the comments, and I will see you back here for our next video.